From the JAMA Network, this is JAMA Psychiatry Author Interviews. Conversations with authors exploring the latest clinical research, reviews, and opinions featured in JAMA Psychiatry.
Hello and welcome to our listeners around the world. You're listening to the JAMA Psychiatry Author Interview Podcast. I'm your host and web editor, Dr. John Torous. Today, we're thrilled to be discussing a new paper just out in JAMA Psychiatry, Association of Soft Drink Consumption with Depression Mediated by Gut Microbiome Alterations. We're pleased to be joined by the first and corresponding author of the paper, Dr. Sharmili Edwin Thanarajah, in the Department of Psychiatry and Psychotherapy and Psychosomatics at Goethe University in Frankfurt, Germany. We know that many factors can impact mental health, of course, including diet, but what about soft drinks like colas and sodas? Is soft drink consumption related to depression diagnosis and severity? And could gut microbiome alterations mediate and explain this association? To learn more, we're going to talk about these brand new results just out in JAMA Psychiatry. So thank you for joining us, Dr. Thanarajah. And let's start broadly. What do we know about soft drinks and their impact on health overall?
Thank you, Dr. Torous, for this invitation. I'm really excited to talk to you about this work. So why are soft drinks so relevant? Because they are the major source of added sugar around the globe. They contain almost nothing else than sugar, and the prevalence is extremely high. So if we just look around the globe, we can see that children and young adolescents consume more than 3.5 cans of soft drinks per week, which is already a high number. And then what is really considered as harmful is a daily consumption. And we think that around 10% of children and adolescents consume soft drinks every day, which is clearly associated with weight gain, obesity, diabetes, fatty liver disease. So there is already great knowledge about the harmful impact of soft drinks already.
I didn't realize it's the number one source of added sugar. That's a striking statistic. And again, assuming, as you explained to us, there's a lot of physical health consequences of having excess sugar, what did the existing data tell us about the mental health implications before your study and the exciting results we'll talk about soon? But what did we know about more kind of the psychiatry implications of this?
I mean, there is already very convincing data that really shows the association between soft drinks consumption and mental health impairments. So there is already longitudinal studies, but also cross-sectional studies showing that soft drinks consumption is related to depressive symptoms, mental health impairments. There is also a recent study showing in this big nurses cohort from the US that soft drinks consumption was also associated with an increased risk of being diagnosed with depression later on, so 5 years later. But what is special about our cohort is that we have really clinically diagnosed depression. So we have patients that have a clinically characterized depression diagnosis, that also depression severity was categorized by a clinician. So that is something what is special about our cohort.
I think what's, again, always tricky about mental health research and clinical implications is there's always going to be causations and correlations. And I think what's also special about your research is you talk about the gut microbiome, and we'll get into how it could be a link between it. But let's review, what is the gut microbiome and what is its potential role in depression? We're talking about a brain illness, but we're going to now diverge and talk about the gut. So what is it, or what is this potential connection?
So the microbiome has really gained attention over the last 2 decades, I would say. And so the gut microbiome is the microbiome diversity that we have in our gut. And it has a huge influence on our immune system, the digestion of food. And recently we have also found out that the gut microbiome diversity is closely related to mental health. And how is the question, of course. So we think that the gut microbiome promotes inflammation, but can also have anti-inflammatory potential. It influences insulin resistance, but also it influences the synthesis of neurotransmitters. So it really has an impact on the brain itself and on mental health.
So if we put all the pieces together and understand the hypothesis in your research, we know that, again, soda consumption is high, a lot of added sugar. We know there's the gut microbiome, it can influence mental health. How do these pieces come together as the hypothesis for the research that you and the team did?
So we knew the piece that soft drinks consumption might be related to mental health impairment. And we also had an idea that if you consume high amounts of sugar, this should have an influence on the diversity of your gut microbiome, because it will promote specific taxa that are very sensitive to sugar. So that's why we were interested in how does soft drinks consumption relate to depression, and is this via the change in the gut microbiome composition?
And taxa being just different types or kind of families of gut microbiome?
Yes, exactly.
Now we understand what you're doing in the hypothesis for the study. Who did you aim to recruit in? When was this recruitment started and finished?
This is a part of a very long, ongoing, huge study, which has been performed in the universities of Münster and Marburg. We have recruited patients with a diagnosis of depression, so major depressive disorder, and healthy controls. And they were all diagnosed by a clinician, so it's a really high-quality diagnosis. And we have recruited more than 2,000 people since 2014.
That's a lot.
Yeah, that's a lot, right? And they all gone through the same protocol, so that's why the data really has a high quality. And then we looked out who of these participants have the full data set that we need for our investigation, and found around 930 participants with full information.
And again, as you said, these patients in the study or participants were clinically diagnosed of depression. Let's talk about that scale, but perhaps of more interest, how do you understand or measure soda consumption? This is a unique thing that we have not covered on the JAMA Psychiatry podcast.
So this is the gold standard that has been used. So it's the food frequency questionnaire.
Okay.
So participants are really interviewed on what do you drink, how often do you drink it during the week, and indicate what exactly did you drink. And then all the dietary composition was quantified, and we focused on the soft drinks consumption.
And then, of course, we talked about the gut microbiome. We're going to understand, is that a link between soft drinks and depression? So how did you capture and process and turn the gut microbiome into data for your paper?
So we provided the participants with collection tubes, and we had a standard protocol how they were supposed to collect the stool at home. And then we got the fecal samples and did the processing. And we did a 16S RNA sequencing, and then looked into the quantity or the abundance of these different types of microbiota. And we knew from our previous analysis that particularly two taxa were associated with the depressive symptoms, and these were Agatella and Hangatella. So we specifically only looked into these two taxa to see if we can find an association between soft drinks consumption, these taxa, and the depression diagnosis.
And for the final sample, how many people are included in analysis? Is there anything notable about just the sample itself before we dive into the exciting results?
So we had around, as I said, 932 participants. These were MDD patients and healthy controls. And we had female and male participants, and all these MDD patients had a clinical diagnosis of MDD.
What did you find regarding the primary one? Is soft drink consumption associated with depression, and especially the severity of depression?
We could really show that soft drinks consumption was associated with the diagnosis of depression, but also of symptom severity. And this was particularly the case for female participants. So in female participants, obviously, soft drinks consumption was associated with higher depression symptoms.
What's fascinating about your research is you have this mediating pathway through the microbiome. What did you learn about the microbiome findings first?
We could show, as expected, that soft drinks consumption was changing IFA diversity, so really the microbiome diversity. And it was also changing Agatella that was previously been associated with depression. So we could really show that soft drinks consumption lead to higher abundance of Agatella. And then in the next step, we looked out if we could find this mediation. And indeed, we could see that the association between soft drinks consumption and MDD diagnosis was mediated by Agatella abundance.
So what's interesting here is you really have more than just a cross-sectional look of soda consumption depression. We kind of have a mechanism at play that's plausible and has been studied before, which is very novel. And in the discussion, though, you write there kind of may be, I think the words you and the team used was a vicious cycle between soft drinks and depression. So is this kind of a chicken-egg situation, or what is this vicious cycle and what does it mean?
It has to be really emphasize that this is cross-sectional study in the end, right? So we cannot talk about causation, it's correlation. We can see that there is a correlation between soft drinks consumption and depression. It could be either way. It could be like depression causing soft drinks consumption or the other way around. So what we think is that really soft drinks consumption leads to changes in the gut microbiome, and that these changes contribute to the evolution and also to severity of depressive symptoms. But this is something that has to be tested in a randomized controlled trial. And the vicious cycle comes because we know that also mental health impairment change our food preference. So, and particularly depression, anhedonia change our food preferences. People start to prefer Western diet, which is high caloric, which is high in fat and sugar. And also people seem to have like a higher preference towards soft drinks. So everyone who works in a psychiatric department knows when we come into a ward that we will see like many soda cans on the patient's tables, right? So the food preferences changes, and this again drives gut microbiome changes, depression severity, and that's why we are in the middle of a vicious circle.
And yet there still are public health implications and things we want to think about your research. These results are rather striking and very convincing.
Mm-hmm.
Clearly, you're not also saying to ban all soda. You say that nowhere in the paper. I'll put that out there. But what are the public health implications you think that can be acted on from these results today?
So, yeah, I think that, as you said, the public health impact is huge here. So we think that we have to act on this. And from our own studies and also other studies, we know that it's pretty hard to change dietary behavior and to stick to a specific behavior. And in particular, it's hard to stick to things that you are not allowed to do. So if you tell a patient don't consume sugar-sweetened beverages, it will be hard for them to stick to this. But still, this is the very first step. So we really ask the mental health professionals to check for the dietary composition of their patients, to give dietary advice, and to really particularly act on the metabolic health of the psychiatric patients. But on the other hand, we need also like policymakers to make decisions and to have more public health impact. And the World Health Organization has already said that sugar-sweetened beverages are harmful for health. And they also just released a protocol on taxing of sugar-sweetened beverages. And data has already shown that countries which has implicated taxes on sugar-sweetened beverages showed reduction in SSB consumption and also reduction in obesity rates. So we really think that introducing sugar tax on sugar-sweetened beverages has a high impact. But there is a but. I want to also say is, talking about taxes for sugar-sweetened beverages, what we have to keep in mind is that introducing a tax for sugar will lead to an increase in artificially sweetened beverages. So we can already see this, that after the World Health Organization has identified sugar-sweetened beverages as a threat for all these non-communicable diseases, companies producing sugar drinks have immediately started to produce drinks which contained high amounts of artificial sweeteners, and also claiming these are the healthy alternatives. So light drinks, zero drinks, and all of this. And we know from intervention studies that artificial sweeteners might even have a larger impact on the gut microbiome. So there is no study yet really showing the association between artificially sweetened beverages and mental health, because it's hard to discriminate. Participants often don't know what they drink. So we really need more data on this. But we think is that artificially sweetened beverages might be even more harmful for mental health.
To review, in your study, we weren't able to separate. It could have been, I'll just call them diet sodas or zero sodas and sugar-sweetened sodas. So clearly on this podcast, we're not here to give anyone medical advice, but it seems like if the World Health Organization has said that there could be physical health implications of sodas, and we now have some evidence, you said we're not doing causative evidence, it's correlational, there's mental health implications. It seems like there may not be harm for people trying to reduce soda consumption. Would that be a safe enough claim to make that people could at least think of that as kind of a lifestyle intervention that may have potential mental health benefits?
I'm always cautious about having claims based on my own data, but if there is a claim that I could make, and I'm quite confident in, I would say reduce soft drinks intakes. It has large impact on metabolic health, but also mental health, for sure.
Future studies will help us understand what are the clinical implications, but you've given us good evidence to be concerned and to think about what these implications could be, as well as an exciting pathway that could explain it. I'm John Torous. I've been speaking with Dr. Sharmili Edwin Thanarajah about the association of soft drink consumption with depression mediated by gut microbiome alterations. To learn more about this research, you can find a link to the article in this episode's description. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com or search for JAMA Network wherever you get your podcasts. This episode was produced by Daniel Musisi at JAMA Network. Thanks for listening.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.